Well, we've joked with some of our guests before. If they're nervous about coming on the TV show, live television, we say it's better than going to the dentist, which isn't fair. I mean, that's not fair to the dentist.
But our next guest probably understands people aren't generally excited about the idea of sitting in a dental chair. She's created an atmosphere that she describes as undental-like because she wants patients to enjoy the benefits of a healthy mouth.
Dr. Amber Allen specializes in aesthetic and family dentistry. Good to see you.
Nice to meet you.
Doctor, thanks a lot. Thanks for coming. Dental Awareness Month, right? So let's spend some time brushing up on all of our dental needs, right?
Right.
What's the most important thing out there?
You know, I talk to a lot of patients every day. The three kind of big things that affect the longevity of our teeth, and you know, one's gum disease. Most people are kind of aware of what that is. That's probably the biggest factor. Some people are more at risk than others, just based on basically the kind of bacteria you have in your mouth. Regular professional cleanings really are important, especially for those people.
Every 6 months?
Every 6 months, and then some people even every 3 months.
Really?
If they're higher risk. Cavities, people are aware of that. A lot of my patients think, you know, brushing and flossing, I'm good, I shouldn't get cavities. And I wish that were the case. Again, some people are more at risk, and it's all bacterial.
Really?
You know, you got the wrong kind of bacteria in your mouth, you're going to get cavities even if you
Mouthwash,
floss.
right?
No matter what you
Mouthwash
do.
important?
Mouthwash can help, but pharmaceutical, you know, prescription are going to be the best.
You got to kick it up
sure,
a notch.
right.
The store stuff doesn't work for
Yeah,
everybody.
they're going to have to work harder than the average person.
So you said 3. What's
Yeah.
the third?
The third is a bad bite, and I would say that's probably the one that most patients are not aware of. You know, the teeth, the muscles, and the joints all kind of sit in this harmony, and if one's off, it affects the others. And, you know, your teeth will really break down if things aren't hitting and sliding correctly. You know, wear, cracks, and it just escalates from there. So it's a bad one, too.
Okay, so there's advances in dental technology out there that have come a long ways and really have progressed the type of patient care that we can get. So what's some of the newest technology out there?
You know, people come in and they're so scared, you know. I mean, so many people have so many bad stories, and even just listening to them and, you know, having a caring staff who really does care, that goes a long way right there. You know, we've got big open windows, we've got TVs up on the ceiling, you know, everybody kind of envisions laying back and you pull that big light over the top, you know. We don't even have those. They're mounted on our heads, and they just point directly
So you're
down
not
into your
staring
mouth.
into light bulbs?
No, yeah, you're looking at the TV and you got headphones. And another big thing recently has been basically a lot of people have had the experience of having a crown. And then I got to wear that temporary for 2 weeks, and it fell off 3 times. And you know, now we can do them in a day.
Wow.
We shape the tooth, we scan it, there's no impression material. Takes us, you know, 45 minutes to design and mill it. It goes through an oven, and we cement it on, and it's
So the
done.
tray with all the goop? Like
No.
that, you're skipping that now too?
The goop tray's gone?
No,
The goop tray.
No goop tray.
We have some images to show, because this to me where your work, it's beautiful. And I think about the difference you're making and the confidence for these patients. Let's start with her. Tell us her story, and how did you help her?
Well, she's young, you know, really sweet gal, and for obvious reasons didn't like how her teeth looked. And, you know, too, a ton of just gingival, that gum tissue inflammation.
Look at and this is the after. of
Yeah,
course.
she basically wore Invisalign for, I think it was almost 2 years, and took her into a completely even bite, nice proportions of her teeth and aesthetics.
Wow.
We always dispense whitening gel with the Invisalign aligners, so she got lighter.
Brighter smile.
And the Invisalign, it's a form of braces, isn't it? I mean,
Yeah, it's basically like a clear plastic aligner.
Yeah.
You wear it all the time, about 22 hours a day, and every 2 weeks you switch to the next one. It just sequentially moves the teeth into position.
Wow, her results were amazing.
It's amazing, and it's amazing how far you can move those teeth.
It is,
And
yeah.
look at
People,
this.
yeah. This guy, older man, and you know, people come in with all different types of awareness. Some people chip a little corner and they go, "Do you see that right there?" You know, and they have other people who wear their teeth way away and they don't even really notice. You know, it happens so slowly over time. But he had a few things going on. Obviously, teeth really short and lots of cavity issues and whatnot.
The teeth were short naturally, or
over time they wore
just
down.
wear down.
Yeah.
And this is the same patient?
This is the same patient. you know, you think, well, let's make those teeth long again the way they used to be. You can't just do that on the front 6 teeth when there's that much wear. It would look crazy.
Are you a magician? How do you lengthen these teeth? That's incredible.
Well, you have to change the bite, and for him it made sense too with all the cavity issues that we had in lots of other teeth. But you know, you got to make those front teeth look nice in the smile line and in the frame of his face, and there's an art to that. But
Wow.
Took
his teeth went from, you know, whatever age he was to like a 30-year-old.
Oh,
it was incredible.
Exactly.
Wow,
Yeah.
I am amazed. Continuing education is something that's a priority for you. Well, why is that, and what's the difference to patients when you invest the time into staying up on all of the technology and treatments?
I feel like you owe it to your patients, no matter what field of health you're in, to be abreast of current knowledge. I mean, there's constantly ongoing research, and I feel, my husband teases me because I just feel like I want to know everything right away, you know, and you've got to balance that with your home life and finding the time to do all that continuing education. But you can do a lot online too. Even dental materials have changed so much. I mean, a crown, you know, patients have had an older, you know, metal crown. They go, I hate this thing. It's bulky and it's got the gray at the gum line. And now it's all porcelain and it's strong. It's pretty and strong, and we never had that combination before.
But the gratification you must get from seeing those before and after pictures, and those are just 3 patients that you showed us, and I can't imagine how many more are out there, but that must make you feel good about the work you can do.
Yeah, definitely. I mean, your teeth are a huge part of your smile, your face, how you look, how you interact, how you eat. I mean, it's huge and really increases the quality of life.
Well, Dr. Allen specializes in aesthetic and family dentistry, so everybody can see her, and you're welcome. If you're looking for a good experience, you want a healthy mouth, call 402-216-7298, and then online you'll find her at myomahadentist.com. It's nice to have you here.
Yeah, nice to meet you. Thanks for sharing those pictures too. Thanks, Doctor.
Next